So our webinar today is about delivering successful digital innovation in healthcare. And part of the reason why we wanted to do this is we've worked a lot in healthcare recently. So we just wanted to share some of our thoughts and our learnings from that. So we're going to just give you an overview of what we'll cover today, who we are and what we do, just to give you an idea of who we are and why we talk about this space, about working with the NHS, the importance of building a business case, creating a first draft, refining your business case, and some real world examples. And obviously, like I say, you'll have a chance to ask questions at the end as well. We're a small consultancy based in Beeston in Nottingham, and we work with the public sector, established companies and startups. And we've worked in all sorts of areas like healthcare, as I say, but also transport, financial services. Really, you name it, we've probably worked in it in some way. We provide research that informs the design of products and services. We do things like interviews, focus groups, surveys, user testing, data analysis, basically anything that feeds into the design from a research point of view. Some of our clients, there's been a lot, but I suppose just to highlight some of the healthcare clients that we have: Health Education England, eConsult, NHSX. We've also worked with NHS England and Improvement, and a few of the others: Pensions Regulator, Education and Skills Funding Agency, LEGO. I always throw LEGO in there because it's one I like to talk about. So the NHS. This is just to give you an overview of what we've worked on and some of the things that we take away from working in the NHS that we think is worth sharing. The research we've done is around researching the needs of NHS staff around finding and attending training events, and I'll talk a bit more about that one later on as one of the examples. Understanding the needs and experiences of doctors and training providers around the delivery of remote training. We did research with primary care staff on their experiences of delivering remote triage and consultations, and we did that over the last couple of years, so you can imagine what it was like doing that over COVID and all of the changes that went on. A very interesting kind of insight into the primary care sector and the use of technology in that sector. And we researched how patients and staff engage with and understand a new NHS app that allows patients to share their data. That was the NHSX project that we worked on. There were a couple of other projects as well. I just didn't want to go on about. There's quite a lot we've done in healthcare over the last few years. And what we've learned, and I suppose some of this won't be news to people who have already working in the NHS or have experience with the NHS, but I think it's worth emphasising anyway, is that the NHS is extremely complex as an organisation. It employs over 1 million people, so that makes sense. It's like 1,000 different companies all trying to work together, and primary care works differently to secondary care, and then you have layers of management, oversight, governance, and obviously it's a high risk, high safety industry as well, or organization, and it just means that any kind of changes that you make need to grapple with a very complex system where the end goal is always to look after the patient. And so if there's any threat to that or anything that jeopardizes that, it will always cause a problem in the long run. One of the key difficulties that the NHS faces is keeping track of what's happening where, because of course it covers the whole of England and Wales, and there are so many aspects to the NHS that it can be difficult for them to know what's happening where and how and why. And much of what we've done for the NHS involves finding things out. So going and asking people and doing research to find out, how does it work in this trust? How does it work in this part of the country? And trying to get a coherent picture of the situation. And forming a coherent picture of the situation is really important before any change is made, because you want to make sure any changes that happen actually make the situation better and not worse. And of course, NHS staff want to deliver safe care to patients, and that's always the aim, but they're also bound by policy, politics and budgets. And so changes might be needed, but they won't always be possible because of the other constraints that people are working under. Approaching the NHS, and obviously this isn't an easy one either, and there's no simple answer, but I suppose from our experiences, this is what we've learned, is that it's important to understand the priorities of the NHS. The long-term plan, which obviously came out in 2019 and has been affected by the coronavirus pandemic and has had some changes and updates and affected by recession and lack of money and etc. So it's not always clear exactly what the plan is, but it's worth keeping up to date on all the new reports, new updates, new articles that are out there, which the NHS is very good at producing. They're very good at saying what they're up to at the moment. And for delivering digital innovation, a very relevant one is a plan for digital health and social care, which came out in June 2022. So it's relatively recent one. It shows their priorities and what they're focusing on. You need to make sure you really understand the system you're engaging with: primary care, secondary care, social care. How does it work? What are the opinions and views of the people who work in that system? What are their needs and constraints? And obviously, primary care is very different to secondary care. Different aspects of secondary care vary very widely. So, people working in geriatrics will have a much different experience to people working in pediatrics. And so you need to understand the situation that they're working in great detail before you suggest a change that could help them or hinder them. And you need to build a strong evidence-based business case. If you demonstrate that you're meeting a real need and improving a situation, or even ticking a box that needs to be ticked, people will be interested. And there needs to be a very strong focus on what you're delivering and what you're giving to people, not on your solution and what your problem is and what your product or service is. And I'll go into that in more detail, and Michael will as well, with the business case template. Mistakes to watch out for, and I think these happen in all industries because we've worked in very many industries, especially with startups, but it's especially true in healthcare. And one of them is developing a solution that's too big or complicated, biting off more than you can chew. So trying to solve a very complex problem, not necessarily with a full understanding of why that problem exists. So trying to do things like electronic patient records, which is obviously very difficult. And trying to solve a smaller problem more effectively is often a better approach. Not delivering enough value to make change worth it. So trying to make a change, but it costs so much effort or time to make that change that actually that change isn't worth it for the value it delivers. Delivering a valuable solution, but not considering the path to adoption. So what would making this change evolve? And that involves looking at, if you did make this change, what else would need to change? What else would be affected? What other knock-on services would be affected by this change? And selling to the wrong person. So not understanding where the value lies. Obviously, if you make a change that impacts nurses, they are your user and they are the people for whom the product or service needs to be developed, but they don't hold the budget and they don't make the decisions. And so you also need to make a case as to why the NHS might want to adopt a change, or if you're not working in the NHS, why that particular healthcare system might want to make that change. And overall, and obviously this is a very brief summary of what we've learned and looked at over the years, but we found that successful digital innovation is evidence-based and is based on a concrete knowledge of the complex healthcare environment and has a lot of strong research behind it. And that doesn't mean that the solution is super complex or super innovative or introduces anything very new or exciting or different. It means that it really, really fits what people need in that environment, solves a problem, answers a need, and therefore then the people who are working with it really want it and really want to hang on to it. And so that brings me on to the second point, which is it fulfills a real need in a way that works for both the users and the stakeholders, i.e. the budget holders or the people who make the decisions, without creating further work, problems, or safety issues. And of course, that's a big deal in healthcare because safety is a huge consideration. It's designed for the particular context it operates in, taking into account the physical and technical constraints of the situation, as well as issues such as budget, data protection, safety, and so on. So if you're requiring someone to hold a tablet, for example, but that person also needs to be suturing a wound, how are they going to do that? They only have two hands. And so you need to be considering the environment that they're working in and the task that they're trying to complete alongside whatever digital innovation you've implemented or you're trying to implement. And a key one is that it doesn't prioritize technology over the needs of clinicians and patients. So we've seen situations where there's technology being introduced that purports to increase safety or increase access, but actually it makes life harder for patients, it makes life harder for clinicians. It's technology for the sake of technology. And the issue with that is it can look shiny and new and interesting to the budget holders, but over time it'll become less and less favoured by the clinicians or by the patients, and eventually it'll die out. The ones that really fit and really suit the environment are the ones that hang on and actually do really well. I'm going to hand over to Michael now to talk about the importance of a business case.
Thank you, Frances. Yes, so how do you keep all of that in your head, and how do you sort of make sure that you're ticking all those boxes? And one of the primary sort of main ways that we've discovered, or that we've sort of used through the years, is sort of central to that is the business case. So basically, this is a clear and detailed description of why your product or service exists and why someone wants to buy or fund it. So ultimately, the business case is a case for change. So it's not just talking about, oh, we've got this product and a description of the product. It's not like a glossy magazine that says, oh, this product's great. It's talking about how the situation will change because of this product. It's about understanding the current situation as things are at the moment, and then how things will change and improve, as well as demonstrating and understand things that might not get better or might be difficult about that sort of adoption. So it's all about the change that's got to take place in order to deliver the value, and making sure that you're making that case all the way through from the situation at the moment through the transformation to where you're going. And a strong business case is really important in lots of industries. It's something that lots of people use in lots of different industries. But it's especially important in the NHS. There's an awful lot of complexity, as mentioned already. There's lots of budgetary constraints, and having this clear evidence-based sort of picture is really important. I mean, in some areas it's vital. It's for certain grant funding, etc. You expect to deliver a business case, but even if you don't, even if you don't have to, it's still very useful to use. Just have the next slide, please. So yeah, like I say, even if it's not 100% essential, as you're not asked for it from a fund or an investor, it's still very useful because it makes you ask the hard questions, and it's a systematic way of gathering information, sort of questioning what you know about an area and what you need to know. And then as you develop it, you'll get clearer and clearer answers and build up a set of evidence about sort of why you're doing what you're doing and the impact of that. And also, it's not just a sort of a dead document. Once you're done, you put it in a drawer somewhere and occasionally share it to funders. You feed the information that's in there, feeds into all the other sort of activities you do around sort of things like pitch decks, grant applications, tender processes, procurements, even just sales and marketing material. All of it could be sort of, a lot of that information could be fed out of the business case. And it also helps sort of steer the direction. And sometimes it just by doing this process, you also identifies different ways that you could deliver your innovation, or sort of encourages you maybe to slightly change your focus, either increasing or decreasing scope, or possibly even sort of making your solution less complex because actually the fundamental need is slightly different to what you thought it was. Next slide, please. So what we've provided is, you should have all got an email with 2 links on it, one of which is to a business case template, which you can use. As you'll see, it's quite simplistic. There's not a huge amount to it. It is something you can do on a whiteboard, but this day and age, people actually do stuff digitally. Not always the best solution. But yes, we've got the template itself, but also a guidebook which goes into detail about each of these sections, how you go about completing them. We'll talk about it briefly today, but all of the nitty-gritty detail is in that sort of that guidebook that we've sent around. So here is sort of just a crude representation of sort of what's there. The main sections that you've asked to complete. As I say, if you go into the guidebook, it gives you examples of how to do this, sort of descriptions of how to do this, and examples of sort of what goes in each section, and some more sort of word case studies as well. So how you use this template, as I say, you can do it on a whiteboard, you can do it digitally. But sort of the basic process involves, first of all, going sort of gathering together your core team. If you've got a digital innovation, you've got an idea that you want to explore, and that could be anything from a project as part of a larger team. It could be a new startup you think you're doing, or it could be a project within a healthcare setting that this isn't actually going to be a company on its own. This is just actually we think this innovation might be a good idea. We think this change might be good. And yeah, gathering together your core team and going through the template and the questions that are within that. is as a first sort of pass as a group. Depending on how complex it is, this could take an hour if it's a very simple solution in a very simple context, probably not the case in healthcare, or it could take sort of up to a day of slogging if it's very complicated, or if there's a lot of expertise that you need to capture that you have in the room. This is always going to be sort of a bit flaky. You're not going to be able to answer all the questions off the top of your head. Some of it you'll have evidence for, most of it you probably won't. You'll probably have some assumptions in there, and you'll probably have some knowledge gaps. So then once you've done this draft, you'll then go about and say, right, what are these gaps and what are these assumptions and how important are they? And then develop a sort of a research plan to identify the best ways to get the extra knowledge, challenge those assumptions, and start reinforcing and sort of improving your case study. And then you iterate it as you go along. It's the more you use it, the better it is, the more useful it is, and it's something you maintain as a project goes on. Again, like I say, it's not something you put in a drawer, it's a living document, and as you learn more, as you work more in the area, as you make prototypes, as you do tests, you get more and more knowledge, and that gets your business case gets stronger and stronger. The next slide. So when you have that initial meeting, there's sort of three main stages. As I say, the detailed instructions are in the guidebook. But the first one is understanding the current situation. So you can't change anything, or you shouldn't be changing anything until you understand what's going on right now. And there's sort of three key bits to this. You need to understand the need. So what's the actual thing that you're doing for people? What is the thing that people require? And it's got to be, who's it a need for? Be specific. Why is it important? So once you describe what you think this need or problem is, why does it matter? Why is solving that an important thing to do? And another one, which I always talk a lot about, which is how's it currently being fulfilled? So if it's a genuine need, there is currently a solution that people are using. Unless the need is being generated in the future because of some change in policy or something like that, there is a way that it's solved at the moment. It might be bad, it might be inefficient, but it will be there. You should really understand that in depth, because only by knowing why that's the current solution will you be able to effectively implement change. And then surrounding that sort of core need that you're trying to look at, you also need to consider the context. So understanding the system that this all happens in, which could be physical, political, social, etc. And also understanding and trying to list out all the stakeholders involved. So who has got skin in the game, who's affected by this need, and the solution that you're proposing. How's that going to affect people? And it's everyone from, like, patients is almost always going to be there in a healthcare setting, but it's also clinicians, it's ancillary staff, it's managers, it's budget holders, it's potentially politicians, it's all sorts of stakeholders, and it's really important you do that work up front to find out who will care about this, so that you don't find out about them later on when it can be really disruptive. Next slide. So then you start sort of unpacking your solution, or what you're going to do about it. And we've talked about this primarily as the value proposition. So it's not about your technology again. The people that you're using your business case to convince don't necessarily care how you are solving it in terms of the technology solution, etc. What they care about is what sort of value you're delivering. So what's the actual impact of what you're going to do? How's that going to change things, both for people on the ground and, like I said, in the broader context? And you also need to show that you understand the risks as well of what you're doing, which could be the risks of your putting your solution in, but also the risks that might prevent that happening. Understanding that is really important, so that you can, well, first of all, mitigate the risks as much as possible, stop them happening or reduce the impact they have if they do happen. But also it's that demonstration that you've thought deep about this area, you understand it, you understand what could potentially go wrong. Within the healthcare setting specifically, really important part of this is understanding what value you're delivering for who. So in that value proposition, it's unpicking, actually, this, we might make a nurse's day better, but what's the follow-on from that? Is that going to increase retention? Is that going to help patients get better care? Because the budget holder, the decision makers are often quite far removed from the context in which you're delivering value. So it's really important that you understand and you can articulate the true impact of this and the real sort of broader value that you're delivering, so you can make those arguments and make sure that you convince the people that need convincing. And that's not to say the people on the ground floor don't need convincing. If you don't have the staff on board, nothing's going to happen. And if they can't see the value as well, but it's one of these particular problems in healthcare is where you have this broad range of stakeholders, and often those with most influence are those furthest away from the problem, which means you've got to do the hard work of showing them why this is an important problem and why your solution is delivering genuine value. And then next slide. And then the last sort of main slides of this when you're completing your first draft is to then think about the practical considerations. So one side of this, you're talking about your costs, your resource requirements. So not just the tangible resources like, you know, money and staff time and things like that, but also things like goodwill. You know, you're going to have to talk to people, you're going to have to get people to change their ways. That's going to require at least some goodwill, potentially training, and thinking about what are limited resources in this situation. One that often comes up in hospital settings is plugging things in isn't always straightforward. Sometimes there literally aren't enough 3-pin plugs in a ward. So how are you going to solve that? You can't just drop a line in. So thinking about actually what's going to change in terms of the resources that are needed, both immediately in order to deliver the solution, but also to maintain it. And again, really important in healthcare about maintenance and long-termness, how long-term your solution is. And that could be about sort of financial viability if you're developing a financial a solution that is a corporate proposition where you're trying to make money. How are you going to make money? What's your business model? But also whether or not it's corporate, what's the long-term costs of this? Are you delivering something that needs oversight? Is there additional administrative costs? Is there physical maintenance on the product? Is there digital maintenance as well? Things like cleaning. If you're putting something into a ward, you might need to the hospital might need to renegotiate cleaning contracts to cover that being sanitized to an appropriate level. And again, you really need to demonstrate you've thought deeply about this and identified actually in the long term these are the impacts that we need to consider, and they can be positive as well as negative impacts sort of in the long term. Right, so I will hand back to Francis, who will talk a bit about how to then go ahead and refine your case study.
Thank you. So yes, refining your business case. So as we said, your first pass might be quite broad and full of questions and full of gaps. That's absolutely fine, especially if you're early on in the journey, you're just developing a new product or service, it's a new innovation. So you would expect that to happen, and that's a good thing, because then you know where you need to focus, what things you need to find out, and what you need to do next. When you do have answers to your questions, though, you do need to identify how you know that answer. Do you have evidence? And this is really important, because what we see sometimes, or a lot really, with startups is they say, yes, we know who our users are X. And when we ask, well, how do you know that? How do you know those people will use it, or that they have this need? There isn't necessarily anything to back that up. It's an assumption. It's a belief. It's something they think because they've worked in that environment, but it could be only particular to that hospital or to that primary care setting. And so you need to have an understanding of, does this exist beyond my belief and my experience in the real world in a wider setting? Can you back up what you've written with data, or is it guesswork? And if it's guesswork, the danger is that you'll be completely off base, and that you'll start to develop your solution and find over time, actually, this isn't a real issue. This isn't a problem that I need to solve. This isn't solvable in this context, or whatever it is. It's not practical to test every assumption. Sometimes you have to assume things, because you just can't find it out, because you need to find it out in future. But anything that is key to the success of your innovation must be explored in depth and backed up with robust evidence. You shouldn't leave anything really key to chance. And of course, that's where we come in terms of the importance of research. Funders, clients, and customers will want proof that what you claim about your value proposition is true, and claims that are not backed up with evidence are likely to be questioned and could potentially scupper the success of your product or service. Even if you're right, even if you know you're right, if you don't have evidence, it will make people dubious about what you're claiming, which is fair enough, because if people are going to give you money, they want to know that you actually know what you're talking about. Research also ensures that you don't spend time or money developing a solution that doesn't have a future. So we've worked with startups who have a great idea, We've gone out and done the research for them, and we've come back and said, well, yes, you can develop this great idea, but there are some serious barriers in your way. Either you've misunderstood this industry and you don't really understand where your product is fitting. It doesn't have a clear route to market. There are too many barriers. It's too expensive to develop. And so you're much better off finding that out as early as possible, rather than spending months, years, a decade developing something that doesn't have potential and that has too many difficulties in its way. The earlier you can pivot, the better. The earlier you can change your focus, the better. And what we find as well is when we do this research early on, what often happens is the startup has developed or has identified a real area of need, but they have put the wrong focus on it. So they've either developed a B2C solution when they should be developing a B2B solution, or they have misunderstood what the actual problem is. And so they're solving something in the wrong way, or they're solving a problem that's slightly tangential to the real problem. And so the research identifies that actually, if you move a little one way or the other, or you change your business model to a different customer, then it'll work. But again, you're much better off finding that out early rather than late. And of course, you can carry out research yourself, and a lot of research, it makes sense to carry it out yourself if you're developing a product, or if part of your team can carry out the research, reading things, understanding things. But in terms of the more complex research, especially qualitative research or even quantitative as well, surveys and such, it's harder than it seems. And so if you have some skill in it, great. If you don't, it's much better to take some advice from people at the very least. And usually it's better to get people who have the skill to run it for you, because it takes that pressure off you and it makes sure that it's done well. Just to list some common research methods, these are probably quite familiar to most people here, but a very basic thing that people forget is desk research. There is a wealth of information out there on the internet. The NHS publishes a lot of blogs, guidance, articles, updates, policy documents that are well worth reading, because it gives you an idea of what's happening so far and what their future priorities are. So read, look at everything that's out there. Surveys are good for quantifying issues and exploring the scope of a problem, but they're very hard to design. And I've seen many, many bad surveys in my time. So approach with caution, make sure you know what you're doing. Interviews are a great way to actually get some in-depth information about the situation. So you can talk to potential users, you could talk to stakeholders and industry experts. And industry experts are one of that group as well that gets forgotten, the same as desk research. There's plenty of people out there who've worked for a long time in various aspects of healthcare, who are now doing different things, or who are still in the healthcare system, are quite happy to talk through their experiences. In fact, sometimes you ask them a question and you get a 15-minute rant, a 20-minute rant, because it's an area of passion for them. And so you can find out from them the reality of the situation and learn from their experience. Direct observation is great in the sense that it gives you a real understanding of the situation. So if you can go into a ward and watch how people do a thing, or you can sit with a GP and they can show you how they engage with a piece of software, that's great for identifying what things are going wrong, what things could be improved. And then testing is an obvious one around building a prototype, and that can be a really, really basic prototype that is just a Figma screen or even a piece of paper, or a minimum viable product, which is the most basic version of a product that you can develop to test how it actually works in the environment. And that can be useful if you're not sure how things will function in the real world. So then you can see, okay, yes, that person's really struggling to input that piece of information because they're trying to gather it from too many places. And so I need to add another level of functionality there to allow them to add another level of detail to the data they're putting in, for example. And iterate, then iterate again. So your first pass of the business case model, the business case canvas, the actual layout of the business case template should be fairly sparse, but over time, it will get more and more detailed as you add more and more information, more and more evidence. And it shouldn't really stay static. You should be getting more detail And you might even start a new one for a new circumstance, because obviously you might build a business case for one situation that doesn't fit another situation, but the same product or service can fit across different situations, different organizations, and you might need to build new evidence for those new situations. The more evidence you have for key aspects of your business case, the better. And the more you can refine your value proposition to pinpoint the exact value you're delivering, the more clearly you'll be able to communicate with potential customers and clients. And pinpointing that value proposition is really important, because it allows you to really say very directly, this is what we'll change for you. This is why you should give us money for this. You may hit a wall at some point and find that you can't identify a real need, or your value proposition doesn't sound quite right. And that's the time to pivot. And the earlier you can do that, the better. As I was saying earlier, you don't want to spend 2 or 3 years developing something and then find nobody really understands the value of this because we haven't articulated it well enough. And actually, we can't find enough value to be able to sell this in. The earlier you can find that out, the better. And a real world example, this is just a very quick one because of time, but I can talk more in detail about examples that we have from our real world experience. So we've done a lot around business cases for the NHS itself, because internally the NHS also needs to build a business case if they want to make any changes. So they wanted to put together a business case. Health Education England wanted to put together a business case to introduce new functionality to their learning solution that allowed NHS staff to find training events. So the potential new solution would allow staff to find events relevant to them based on their searching history and account profile. So this was an actual solution that was already kind of thought about and put together. They needed to make a business case, but first they wanted to find out how staff were currently accessing events and any barriers or issues they faced. And this is all goes back to the need that we talked about earlier, the context. So how are people currently how are people engaging with training events, and how are they currently solving that problem as well, which Michael highlighted. You need to know what solutions they're currently using, because that gives you a lot of insight into all the barriers that they're facing and how they've managed to work around them. And so they asked us to research the problem area and provide evidence for this business case. And we did interviews and we did focus groups. We talked to various NHS staff in different roles, and we found they'd made too many assumptions. So they assumed that there was difficulty for NHS staff to find information, so they just weren't getting the information. And actually, the issue was that NHS staff, unsurprisingly, have limited time and budget, so they needed more kind of focused and bespoke support from people around them and from any sort of software that they used in order to identify which events to attend, because there were lots of events, lots of places they could go, lots of things they could do, but which ones were the most benefit, which ones were the ones they should attend. And so the research then helped HEE to make an evidence-based decision on the future direction of the project based on the real need that staff had. So that kind of covers all of the detail that we wanted to go through today with you in the webinar. If you'd like more help in using the template, and if you can't find the template, which we should have gotten sent, and the guidebook, it might be in your spam folder, or you want some advice on developing a digital product for healthcare, I'll be running free half-hour clinics over the next few weeks, and you can feel free to book in if you have any questions. You'll get an email with the link, so you can I have some times set aside to chat through for half an hour with people. And you can always email me as well if you have any questions.